I am going to discuss how to assess nasal bone in the fetus during NT scan. It is usually done by 11 to 14 weeks. To assess the nasal bone, you have to get the fetus in the mid sagittal plane, and zoomed in images should be obtained. The zoomed in images should have mostly of fetal head and partly of fetal thorax. And to say how uh, it is a mid sagittal or not, you have to see the nasal tip, you have to see the diencephalon, and above palate there should not be any maxillary bone lying over there. So after getting the mid sagittal and zoomed in images, you have to assess three structures in the nasal region. What are they? First is the echogenic line is the skin surface, and below it is the nasal bone, which has to be present and also brighter than the skin surface, and anterior to both of them is the nasal tip. So these three structures should be seen to assess the nasal bone, and only if the nasal bone is echogenic than the skin surface, then you can consider it as normal or present nasal bone. And then below the nasal bone you can see the palate, which is rectangular in shape, and there should not be any maxillary bone lying over the palate, and below the palate you can see the mandible. So you have to see the skin surface, you have to see the echogenic nasal bone brighter than the skin surface, and anterior to them will be the nasal tip, and below the nasal bone you can see the palate. There should not be any bone maxilla above the palate, and below the palate you will be able to make out the mandible. But in this case what you are seeing is skin surface is seen, but the nasal bone, which has to be brighter than skin surface, it is actually not visualized in this case, and anterior to them of course nasal tip is seen, and below palate is seen, no maxilla, so it is taken in midline, and mandible surface is seen. So the nasal bone is absent in this case. Thank you.